Good evening, and welcome to our educational webinar on Lapiplasty 3D bunion correction. We appreciate you joining us. I'm Kendall Rock, social media specialist at Treese Medical Concepts. Treese Medical is the company who patented the Lapiplasty procedure and manufactures its instrumentation and implants. Our goal here tonight is to provide you with quality information because we know that making a surgical decision is a decision that isn't taken lightly. We applaud you for empowering yourselves with information to make the best informed treatment decision you can. I will quickly get a couple of housekeeping items out of the way so we can get right into the presentation by our surgeon speaker, Dr. David Paganelli of Waynesboro, Pennsylvania. First of all, you are all listening to the webinar on mute, but you can ask questions throughout by clicking on the Questions tab in your control bar and typing them in. We'll be answering questions sprinkled throughout the presentation and at its end. We will also be emailing you an archived link of this presentation to refer back to within just a few days. Lastly, I know that you will enjoy our speaker, Dr. Paganelli, but if you are attending outside of Pennsylvania, you can find locally trained Lapiplasty doctors in your own area to consult with by visiting our patient website, lapiplasty.com. There is a prominent Find a Doctor button at the top of the homepage, searchable by your zip code. With all of that out of the way, I'd like to introduce tonight's surgeon speaker, Dr. Paganelli. Dr. David Paganelli, Jr. is a graduate of Temple University School of Podiatric Medicine in Philadelphia, Pennsylvania. He completed his residency training at the University of Pittsburgh Medical Center Pinnacle Health System. Dr. Paganelli's training consisted of foot and ankle elective surgery, trauma and reconstructive surgery, diabetic limb salvage, and wound care. Additionally, Dr. Paganelli has completed courses with certification in microsurgery from the Cleveland Clinic, as well as specialized training in arthroscopy, internal and external fixation, and various surgical techniques. Dr. Paganelli is a fellow of the American College of Foot and Ankle Surgeons, as well as a fellow of the American College of Podiatric Medicine. He is board certified in rear foot, ankle, and reconstructive surgery by the American Board of Foot and Ankle Surgery. We appreciate Dr. Paganelli volunteering his time tonight with us. I will return to moderate a question and answer segment at the end. And now, Dr. Paganelli, take it away.
Thank you. So just some quick housekeeping. The Lapiplasty system, FDA cleared since 2015. It's not an investigational device. It's patented procedure, manufactured by Treese Medical Concepts, requires advanced training, not offered by all surgeons, over 90,000 patients treated, covered by most insurances. Medicare cost and coverage vary. Check with your provider. You can find a trained surgeon at www.lapiplasty.com. So some potential adverse events or comorbidities, infection or adverse reactions for a foreign body, pain, discomfort, or abnormal sensation due to the presence of the implant, loosening, bending, cracking, or fracture of the components, or loss of fixation of the bone attributable to non-union, osteoporosis, markedly unstable comminuted fractures, loss of anatomic position with non-union or malunion with rotation or angulation, migration of the implant, loosening of the implant, delayed correction in alignment, decrease in bone density due to stress shielding or bursitis. So all these types of complications are typical complications that can happen with any type of implant or in your body or bunion surgery. They're not specific just to Lapiplasty. So let's talk about bunions. So more than a bump. So bunions can cause pain, swelling, pressure, numbness. It's a misconception that the bunion's just an overgrowth of bone and you can shave it off. Typically, bunions start at the root or the unstable joint of the tarsometatarsal joint, back approximately on the foot, but the pain is up here near the metatarsal phalangeal joint where the bump is. And we'll get more into that in a couple minutes. So in reality, bunions are pretty complex. They're not just a bump. They're caused by an unstable joint, like I was talking about, in the middle of the foot. They're aggravated by all types of shoe gear, certain types of rubbing or walking. Most people typically complain of neuritis or nerve pain along this bump on the side of their foot. Usually they are from a genetic predisposition, at least that's what I typically see. Sometimes it's a biomechanical imbalance if you have a flat foot or some other type of deformity. But it's an angulation, or your bone drifts out from this proximal joint right here in the middle of your foot. So traditionally, there are multiple different types of treatments. There's a traditional 2D osteotomy, which is something that we call a head procedure because it's at the head of the metatarsal bone here. Typically, you cut and shift the bone and fixate it with screws or pins. There are hundreds of different types of 2D or head procedures, all different types of cuts, and you shift them over and you fixate them with screws. They don't address this unstable joint back here, your tarsometatarsal joint. There are non-surgical or conservative treatments like toe spacers, pads, splints, inserts, orthotics. I don't really believe in these splints. You put them on, your toe goes straight, you take them off, you have a bunion again. But orthotics and inserts, they tend to help and slow the progression of the bunion. They don't fix it. They don't. There's no permanent fix there, but they do help. None of them really address the hypermobile, unstable joint in the foot. So Lapiplasty, the 3D bunion correction, how it works is it returns your bone to normal alignment. We address that unstable joint. So if you look at this fixation here, this 2D traditional osteotomy, they shift the bone over, but you still have this angulated deformity. If you look at the Lapiplasty, you will see the bone is in corrected position. Sorry if you just heard a baby crying. But you'll see that the bone is straight and is in a normal position. We actually address the deformity and return it back to normal alignment and anatomical alignment. So some questions. How do you determine if a patient is a good candidate for Lapiplasty? So you go to you consult with a surgeon and they'll take x-rays and they'll tell you if you're a candidate. Bunions, well, can you do it with a moderate or severe bunion, or is there a bunion so severe that it can't be treated? So in terms of both of these questions, for me personally, a person is a candidate for surgery if they have pain. If you have pain 3 to 5 days out of the week, you're a candidate for this surgery. Lapiplasty can treat mild, moderate, or severe bunions. You don't have to have a super severe bunion. You don't have to have a moderate bunion. Whereas the head procedure really is only done on mild or moderate bunions. So can I get a Lapiplasty procedure if I have already had a previous bunion surgery? The answer is absolutely. In fact, we do this quite often where a patient had the head procedure or 2D procedure or a failed Lapidus procedure, and we correct it permanently with a Lapiplasty procedure. So how's the Lapiplasty procedure different? So it corrects in all 3 dimensions. It doesn't just cut and shift the bone. It addresses that root cause, that proximal tarsometatarsal joint in the middle of the foot where it's hypermobile. And the most important part is you get back on your feet within 2 weeks, which is a big selling point. So, and we'll get into the recovery a little bit later. So what happens if you don't treat your bunion? So they get worse. They're progressive disorder. You can get toes that cross over, hammer toes, bone spurs, ball of the joint pain, ball of the foot pain. But the most common thing that I see, other than the bunion getting worse, is the neuritis or the nerve pain around the bump. There's a large nerve that goes right over the medial side or the inside of your big toe joint. And that rubs a lot and people get a lot of pain. So the results may vary, but typically the correction is pretty substantial. And you can see the difference in the foot size and the deformity change before and after, and all the way down to 6 months post-op. You don't lose the correction. It changes the weight-bearing surface of your foot. You propel better out over your toe joint, and you have no pain. So recovery. So this is the biggest part and the biggest selling point, I think, for patients. For me personally, how I treat these and how I do this differently. Before, when I was doing a traditional Lapidus procedure, which is at that same joint, we would non-weight bear them for 6 to 8 weeks. The Lapiplasty hardware and the specific procedure allows us to weight bear them within 2 weeks. So if you're a young, healthy individual, you may be able to weight bear for me day one in a boot, not 100%, but 15 to 30 minutes an hour. Whereas a little bit older person with some osteoporosis, 65 years old, we're going to non-weight bear you for 2 weeks. But then at 2 week period, everybody's in a boot. Everybody's walking in that boot for another 4 weeks. And typically at 6 weeks, you're back in a sneaker. And some patients, depending on their severity, their age, and their comorbidities, they may need 1 or 2 weeks of physical therapy if they lose some muscle mass. But usually you're back in high impact sports within 4 to 6 months. So is Lapiplasty procedure covered by insurance? What about Medicare? Absolutely. I've never had an issue. So obviously when you go to a surgeon and you book a surgery, they're going to run it through your insurance and they're going to let you know if it's covered or not. Here in Pennsylvania, I've never had an issue getting it covered. If you have pain, if you are a candidate for surgery with pain, then you're typically covered. And I bring that up again because for me, that's the biggest prerequisite. This shouldn't be an aesthetic procedure. It should be if you have pain, because you can always have one of those complications that we talked about before. Do we have any questions?
Thank you very much, Dr. Paganelli. We've had several questions come in this evening. Thank you for the great audience participation. We'll do our best to answer most, if not all, the submitted questions now. If you haven't yet, as a reminder, you may ask a question by clicking on the questions tab in your control bar and typing it in to us. Before I turn your questions over to the doctor, I'll start by answering a quick question that has come in repetitively, during the presentation. One of the biggest questions we've received so far is, after surgery, when can I get back to wearing my normal shoes, and some of those shoes being high heels?
So as a foot and ankle surgeon, I am always going to tell you high heels are not a good thing for you. They're terrible for your foot. The truth is, after surgery, if getting back into high heels, I would imagine you're probably okay to go back into them maybe 10 weeks after surgery. It just depends on your swelling. So another issue with foot and ankle surgery is swelling. Gravity is not our friend. So when your foot's down with gravity, it's going to swell. When you have any type of trauma or surgery, which technically is trauma, you're going to swell, and you're going to swell more than you would anywhere else in the body. So that's probably the biggest complication we have is postoperative swelling, but you get that with any type of foot and ankle surgery. So I usually have people wear a compressive wrap for a few months after surgery. Sometimes only a week, sometimes sometimes the patients don't need it. But I would imagine if you can get back in terms of the healing process, back into a heel at 10 weeks, although I would never recommend you wear a heel. But if your foot can fit in the heel because it's not swelling anymore, probably 10 weeks.
Okay, thank you very much. Another question that has come through is, I'm a 63-year-old active male. How long before I could start playing golf or other leisure activities again?
So I would say for my patients, I've allowed, like, I put them back in a sneaker. I would say 95% of them are back in a sneaker at 6 weeks. If you're a little bit older, what did you say, 65? Probably back playing golf by 10 weeks, maybe 8 weeks, if you recover well, if you don't have a lot of comorbidities.
Great, thank you so much for answering that. Another question that has come through is the Lapiplasty procedure covered by insurance and or Medicare?
Absolutely. I've never had a denial. Like I said before, it's all about pain. If you have pain, and the surgeon codes you have pain, it's going to be covered. It should be. I mean, you should check with your own surgeon, but it's my personal experience. I've never had one not covered. The only thing that could be in your way for a Lapiplasty procedure is if you go to a surgeon who isn't Lapiplasty certified, or the hospital they perform surgery at doesn't allow Lapiplasty, or they have a contract with another company. That's the only thing that would not allow you to have the surgery.
Okay, great. Another question that has come through is, can I get both my feet done at the same time?
Not with me. There are some crazy people out there that would do that, but that's a mistake, because you need at least one good foot to stand on. Because like I said, most people, we non-weight bear for 2 weeks. Some people we don't, but even if we don't, it's a mistake to do bilateral feet. There are some older surgeons that used to do that all the time, and they had a lot of complications. And I can tell you right now, I don't know anybody who does both feet at the same time.
Okay, great. Another question that has come through is, I have a hammer toe on one foot as well as the bunion on both feet. Is the hammer toe something the Lapiplasty procedure can also fix at the time?
So the Lapiplasty procedure is not, but we do this, we would fix the hammer toe at the same time. There's always concurrent procedures. You do the Lapiplasty procedure, the person has another deformity or problem like a hammer toe, we fix it at the same time in the operating room. Something like a hammer toe does not extend the recovery time at all.
Alrighty. Another question that has come through is, how long before I can go back to work if you're on your feet all the time during your work?
I wouldn't, well, it depends on how old you are and what actual work you do. I mean, if you're, say, a factory worker and you're on your feet all the time, you're definitely looking at probably 7 to 8 weeks. And the reason is, even though you're going to go back into a sneaker at 6 weeks, you're going to need time to adjust there. Usually you're going to be a little bit stiff. You're going to have to sort, you're going to have to ease back into activity like any other type of surgery, because you were just in a boot for 6 weeks. So I would say 8 weeks. I would plan on 8 weeks. Now, if you have a desk job,
great.
It's a little different, because I've had patients where they take 2 weeks off of work and then they can go back to work at week 2, or sorry, start at week 3 and sit at a desk with their foot elevated.
Okay, thank you for answering that one. Another question that has come through is, can you do a Lapiplasty procedure on a tailor's bunion?
No. I mean, I've never done one. I don't think so. We don't typically, for a tailor's bunion, we don't fuse the tarsometatarsal joint. It's not, I've never even seen that, to be honest with you. So that part of the foot is not good when it's rigid. So for tailor's bunion, we do an osteotomy type procedure. Yeah.
Great, thank you. Another question that has come through is how long does the procedure typically take?
So this varies with surgeons. My time in the OR is typically 25 to 35 minutes, depending on how bad it is. And if there's any other, if I'm just doing the Lapiplasty, it takes me 25 minutes, maybe 30 minutes. If I'm doing other procedures like hammer toes with it, you can add on an extra 10 minutes per procedure, depending on what it is, sometimes longer. If you have poor bone stock, osteoporosis, it might take a little bit longer. We might have to correct some other deformities, but usually it shouldn't ever take more than an hour to an hour and a half if you have lots of other procedures. If you're just doing Lapiplasty, it can vary per surgeon, but for me, 25 to 35 minutes, I would imagine.
Great, thank you. Another question that has come through is, can you elaborate a little bit more on how the Lapiplasty procedure recovery process looks like?
Recovery what looks like?
The recovery process looks like.
Sure. So when I have a Lapiplasty surgery, I will typically, if we'll pretend this is a 65-year-old female, I'll put them in a splint for 2 weeks. So I'll see them 3 days after surgery, take an x-ray, make sure everything looks good, check their incisions, put them back in the splint. They'll be in the splint for 2 weeks. I'll see them again, take it off, take x-rays, place them in a short cam boot, one that just comes above their ankle, and they'll start weight bearing 15 to 30 minutes per hour. I'll see them 2 weeks later. And then, by the way, and when they're not weight bearing, they're elevating their foot still. I still want them to elevate. I will see them 2 weeks later, take another x-ray, check everything, make sure everything looks good. And they'll be able to start weight bearing fully on their foot for the next 2 weeks. And then at 6 weeks, I'll see them, well, it's 6.5 weeks, I guess, because 6 weeks and 3 days, I'll see them again. And I'll transition them into a sneaker, and I'll offer them, depending on how, I'll examine their calf muscle and see if they've lost a lot of muscle mass, which can happen. And if they have, or they feel really weak, I'll send them for a week or two of physical therapy, but they'll be in a sneaker. It's very rare I have to send people to physical therapy, but it does happen.
Great. Thank you so much for answering that one. Another question that we have come through is asking about what they can, the pain level of the procedure. What does the pain level look like for patients?
So this is a good question because I didn't talk about it in the webinar, but I probably should have. So, a Lapiplasty it's a new type of procedure based off of an old procedure called a lapidus, where a lapidus is in the same joint, that proximal joint in the middle of your foot, where we fuse it kind of the same way, but the Lapiplasty procedure has a little bit better technique and better hardware. I get a couple patients that might have a day or two of pain, not crazy pain. The real pain they feel is swelling. They have their foot down with gravity when they have to go to the bathroom, or when they're doing their walking, they can feel it swelling, and that's when they have to elevate. And that's when they feel some pain. Typically, it's not a very painful procedure, although, don't get me wrong, it can vary, but it's usually not crazy painful or known to cause a lot of pain.
Another question that has come through is, as a person who works out on a daily basis, would I be able to get back up on my feet, and how long would that take?
High impact weights and working out, you're probably looking at 4 months. I mean, it depends on what you're doing. If you're biking or you're running, you're probably looking at 12 weeks, because that's kind of high impact. If you're talking about going and lifting weights with your upper body, you can do that. I would say at 6-7 weeks when you're back in the sneaker. I'm okay if you're doing that, as long as you're not doing leg work. You probably need a good 8 to 10 weeks for your bone to really heal in your foot, and to be safe, 12 weeks.
With the Lapiplasty procedure, what can I use to alleviate pain? What do you recommend in your practice to your patients during the post-op recovery process?
So I'm pretty stingy because people don't seem to ever need them. I give patients 3 days of Percocet, and I can tell you that it is extremely rare that they use it. And then after that, they're using ibuprofen. Now, I do give some people a muscle relaxer for the first 2 weeks, the older population if they need it, if they're non-weight bearing for the 2 weeks. But usually they get by with ibuprofen. But I do give them a few days, and only a few days, of Percocet. And if they don't want that, we can do tramadol, which is a narcotic level NSAID. But it's very rare that they need any of these.
Another question that has come through is, can someone with diabetes have this procedure?
I operate on diabetics all the time. It just depends if it's controlled. If you're a controlled diabetic and your A1C is acceptable to your surgeon, you can have the procedure.
Another question that we get quite often is, once I have the Lapiplasty procedure and I have the hardware in my foot, will my foot go off the airport with a metal detector?
I have not heard that. The answer is no, it should not. At least no one's told me it would. I should say that. I've never had that problem.
How long after surgery will I be able to get into a swimming pool or do outside activities, and more importantly, drive?
If it's your left foot, you can drive at 2 weeks. If if you don't drive stick, you can get into a pool at 6 weeks, as long as you are healed completely and you're not jumping up and down in the pool. You can get your foot, you can submerge your foot in the water, I should say. You really shouldn't be doing any high impact anything, which can be in the pool if you're jumping up and down or pushing off the sides, for probably 3 to 4 months. So it depends on your age, really, and your bone stock, but I would say at least 12 weeks.
Okay, great. In your experience as a doctor, do you recommend knee scooters to your patients?
Recommend what? Sorry?
Do you recommend knee scooters to use during post-op recovery to your patients?
Yeah, absolutely. We for the first 2 weeks, if you're non-weight bearing, if you're one of those people that fall into that category, then I usually prescribe them a knee scooter. I don't think anybody can really use crutches unless you're 20 years old and an athlete. It's more dangerous for you. So I do recommend knee scooters, and I typically write a prescription for them.
All right. Another question that has come through is, what is the age limit for having this procedure done?
The oldest person I've done this on was 82 years old, and they were a very healthy 82-year-old. That depends on your surgeon and your health. If you have good bone, you don't have any bad comorbidities, you're a candidate if you have pain.
Okay, great. Going back to how we were talking about having the surgery done for both your feet, in your experience, how long do you typically wait to have the second foot done?
I would say 12 weeks after the first foot, you can have the second foot done. That just ensures that everything is healed. And I've done that. I think I've done it as soon as 10 weeks, but I think I was a little uneasy about that. But she was a very healthy person, and I believed it was fully healed. And she did well with the other foot.
Okay, great. Thank you. Another question that has come through was, how big, in your experience, what does the incision look like, and how big is the incision on the foot going to be?
So it depends on your surgeon. Some people use a larger incision, some people use a smaller incision. In terms of Lapiplasty, I perform the micro Lapiplasty. My incision is 2 centimeters, sometimes 2.5 centimeters. But the typical Lapiplasty is more like 3 to 3.5 centimeters. It's definitely smaller than the traditional Lapidus procedure. It just depends on your surgeon preference. My incision, like I said, is about 2 centimeters. I have a very small incision.
In your experience, how long would you recommend for your patients to wait, if at all, to begin travel, specifically flying?
So it depends. So you have surgery, it can be dangerous with blood clots, things like that. I would probably put you on a blood thinner if you were going to fly. I have had patients that needed to travel during the postoperative period, and they've done fine. I wouldn't recommend it over the first 2 weeks, probably over the first 3 weeks. Probably the latter half of the recovery would be okay.
All right, thank you. Another question that has come through regarding lifestyle activities is, when would be the earliest for me to get back to biking and or cycling?
So that can be pretty high impact on these joints in your foot. So I would have to say, closer to 4 months instead of 3 months. It just depends on how you heal. But it's a pretty high impact sport. So I would say closer to 4 months.
Another question that has come through regarding the Lapiplasty procedure is, can you describe what the scar would look like post-surgery, and what are ways to minimize the scar?
So I have a lot of patients that after a year, they don't have a scar. You can't even see it. I have some patients that don't heal very well and you can see it and they get a big scar. Although it's very small in length, it's a noticeable scar. That is all surgical, surgeon technique and patient's genetics, really. So there are different types of oils and creams you can put on scars, vitamin E, cocoa butter, things like that can minimize scars. Most of my patients don't have to do any of that, but it does happen. I mean, sometimes we get patients who are known to get keloids and heal poorly, and they use those, and it does minimize it.
Okay, great. Next question regarding travel as well. How soon in the post 2-week recovery process am I able to drive? Would you recommend in your experience, Dr. Pagnanelli?
It depends on which foot. If you are driving an automatic and you had surgery on your right foot, you cannot drive until probably 6 to 7 weeks, until after you fully recovered. If it's your left foot, you can probably drive around 2 weeks, maybe the start of the 3rd week. But not if you're on a narcotic. If your surgeon gave you multiple weeks of narcotics, you cannot drive.
Okay, thank you. Can this procedure also address significant pain from hallux rigidus?
So that's a complicated question, because if you have a complicated bunion where you have a really bad bunion and you have arthritis, which is what hallux rigidus is in your first MPJ, having this procedure will not fix the hallux rigidus. And depending on your age, you might have another procedure on your first MPJ, either at the same time or at a later time.
Thank you. Can you explain in more detail how you return the bone to proper alignment and what the implant is?
Yeah. So we operate on that joint called the tarsometatarsal joint, the first tarsometatarsal joint, where the bunion deformity kind of starts. And what we do actually is we take the joint out. We make a wedge cut. So we, it's kind of hard to explain, but we take a wedge of the bone out in the joint. So we take all the cartilage out and we wedge the bone so that when it sits back down, it sits straight. And then we take either plates or screws, because there's 2 different types of fixation for this. There are, plates or staples. They're like speed plates. So there are the traditional 4-hold plates that are used on the top and the side of the joint. And then there are 4 and 2-hold speed plates that are used in the micro procedure that are in the same orientation on the top and on the side, and they add added fixation, and we fixate it straight. So we take a wedge of the bone out, not just a cut and shift. We actually take the joint out, which is the same type of traditional Lapidus procedure, but this hardware and the corrective device and guide, as what it's called, and the clamp that to reduce the deformity are kind of the staple of what the Lapiplasty surgery or procedure is and why it's so special. I hope that made sense.
Yep, definitely did. All right, another question that has come through is, does the Lapiplasty procedure change your shoe size?
So it depends. If you were wearing a really wide shoe because you have a really bad bunion, then yeah, absolutely it can. Some people wear larger shoes or wider shoes because their bunions are painful and they rub on the sides of their shoes. They get that neuritis I was talking about earlier. So it can bring you down a size if you're wearing larger shoes because of the pain. But it shouldn't change the length of your toe to an extreme that it would change the size of your shoe.
Okay, great. Thank you for that. How often do you follow up with your patients in your own experience, Dr. Pagnanelli?
So I'm pretty type A, and I don't like patients to go long without seeing me. I see patients 3 days after surgery and then every 2-week intervals. until they're back in a shoe and discharged. And sometimes if I send them to physical therapy, I'll see them after physical therapy.
Is the Lapiplasty procedure a same-day procedure?
Yes, outpatient, same day.
All right. Another question that has come through, and this one is a little bit more specific. I'm a college gym cheerleader. How soon would I be able to get back out there on the court?
So, being young and likely healthy, chances are you'll be able to be out there, I would imagine, back in 8 to 10 weeks. If you follow directions at the beginning of the post-op period.
Another question that has come through is, will this procedure help with gout and frozen toe?
No. I mean, that's a quick answer. Gout is a systemic issue. You can absolutely continue to get gout. It shouldn't change that.
Thank you very much. Another question that has come through is, I walk about 10 miles a day for work. How long would it take me to be able to get back to doing that on a regular basis in your experience?
That's a lot of walking in one day. So the truth is I would imagine you're going to have some swelling because you're on your feet a lot during the day. And even though you're walking, it's still going to be pretty swollen. I would plan for 4 to 6 months to be 100% back to your normal self. Maybe 4 months, but I would plan for 4 to 6 months. You might be able to do half of that at 3 months. It just depends on how you heal and how much swelling you get.
In your own experience, do you recommend a nerve block for patients?
A nerve block, so in my experience, I don't. My patients don't seem to need them. I've never had to use one for this surgery. Now I do a lot of other larger surgeries, reconstructive surgeries, that require them. This one does not typically.
Okay, good. Thank you. Another question that has come through is, I have several health issues. Am I still eligible to get the Lapiplasty procedure?
So without knowing specifics, I can't tell you yes or no. It just kind of depends. Like I said, you can be a diabetic if you're controlled. You can have surgery. You can have lots of different things and still have surgery as long as they're controlled or you're healthy enough to have anesthesia and you're not on an immunosuppressant for, you're not on a cancer drug where it stops you from healing. Like you can't have surgery if you're on that. There's, those types of things you can't have any surgery. You shouldn't have any surgery or elective surgery on.
Okay, great. Another question that has come through is, if I'm a smoker, will that stop me from being a candidate for this specific surgery?
So also surgeon preference for me, yes. Smoking is terrible for you and it is not, it inhibits you from healing. If you're a chronic smoker, you will not heal well and you may end up being worse off after surgery. So it's not recommended to operate on smokers. If you can quit smoking and stop smoking for 3 months, we can do surgery. We check your arteries, make sure you're good and you're cleared, and then you can have the surgery. But you'd have to stop smoking.
The next question is, how soon can I get it wet? And specifically, how soon am I able to return to swimming, let alone daily activities such as showering?
So 2 weeks is when the sutures are either coming out if we put non-absorbable, and if you were a candidate for absorbable, it's still gonna be 2 weeks. We wouldn't have to take them out, but you'd be 2 weeks for the incision to be healed, about 14 days. That's when you can get it wet in a shower. You cannot submerge it in water till about 4 weeks.
Okay, great. If I've had a previous bunion surgery, could this be done to correct that previous surgery?
Absolutely. Like I said in the lecture, we do this all the time. People have that 2D or head procedure type of surgery, and it is not permanent. So we typically fix other bunion procedures that patients have had with this type of procedure, with Lapiplasty.
Okay, next question. What kind of anesthesia is used?
So I typically use general anesthesia. It's a little bit big of a procedure to use a local anesthetic with MAC or monitored anesthesia care because you really need muscle paralysis. I prefer general anesthesia. That's usually how I book the surgery. Some surgeons may vary.
Regarding the Lapiplasty hardware, how soon, does the hardware ever have to be removed?
No, hardware is very rarely removed. It's not, it's only removed if it's painful, which for me personally, I have not come across other than one time, and it was not the Lapiplasty that was the pain, the problem. The patient did not heal or follow directions, and we had to just revise it. And we actually didn't have to take the hardware out, we just revised it. So no, it doesn't ever have to come out unless it causes an issue.
How young can someone be to have this procedure done?
The growth plates need to be closed. So that being said, I've done this on a 14-year-old girl because her growth plates were closed, and she had a terrible genetic juvenile bunion that was extremely painful.
Okay, thank you. If I have arthritis, could I still get this procedure done?
So one of the indications for this is arthritis of the tarsometatarsal joint. Arthritis of the first metatarsal phalangeal joint, which is the bump, is a little bit different. It depends on how bad it is. If it can just be cleaned up, it's really case specific. But this procedure does not treat first metatarsal phalangeal joint arthritis. It treats bunion deformity or tarsal metatarsal joint arthritis, which is the joint that's proximal or in the middle of the foot. I'm using big words. I just don't really know how to show you other than say that. I don't know how to explain that. But it doesn't treat what I talked about earlier, hallux rigidus, which is arthritis of the first metatarsal phalangeal joint, or the where you get the bump.
Okay, next question. Can a bunion be too severe to be treated?
No. No, I've treated, bunions where the big toe is underneath the second, third, and fourth toes. It's so crooked. The answer is no. There's no severity that cannot be treated.
If I have a pretty significant bunion, but am not in pain, would you recommend I wait to get the procedure done?
Yes, like I stated before, I don't operate on people who do not have pain, mainly because of that the second slide I talked about, which is the complications that can happen. You can have pain after surgery. You can have, depending on who's doing your surgery, depending on if you listen, your bone stock, just how you respond to the surgery, there can always be a complication. And if you have no problems to begin with, other than you don't like the way that it looks, versus you have chronic pain after surgery, I would not recommend the surgery unless you have pain.
Do you ever have to fuse the joint in the big toe?
Do I ever fuse it? Is that what you said?
Yeah.
Not with a Lapiplasty. I don't. I fuse it all the time as a different procedure for hallux rigidus, not related to a bunion deformity. It is absolutely indicated for certain types of bunions with arthritis, depending on what is actually happening. You know, everybody's foot's a little different, and there are different indications for different types of procedures.
Another question that has come through is, I have a 2-story house. How soon am I able to walk up the stairs and get to the 2nd floor?
So depends on how old you are, and it depends on your health. But, you know, if you are weight bearing immediately in a boot, like a young healthy person would be after this surgery, you can, well, one, you can always, if you're non weight bearing, you can always go up on your butt. I know you don't want to, but that is an option. But I would imagine you can lead with your good foot and go up the stairs within a couple days. But it's not recommended to be pushing off that foot in the first 2 weeks, even if you're in the boot.
Another question that has come through is, if I am on a weight loss drug, can I still have the procedure done?
So that's pretty specific, pretty non-specific. It depends on the drug. If you're on Ozempic, it has to be stopped before surgery. There are some other drugs that are like that as well, and that's more of an anesthesia issue.
Okay, great. Another question that has come through is this an outpatient procedure?
Yes. Go home the same day.
Okay. I've had a couple people join late, so I'm going to revisit a few questions that have come through that are early on that a lot of people have asked us. One of the questions that have come through late, again, is what is the typical recovery time for a Lapiplasty procedure?
6 weeks. Typically, you're back in a sneaker at 6 weeks. Sometimes 8, depending on your health.
Another question that has come through again is, how do I find out about if Lapiplasty isn't covered by my insurance?
So you can call your insurance and ask them, but like I said, I have never come across an insurance that wouldn't cover it. As you know, insurance doesn't pay for the specific type of procedure. It pays for the surgery in general. So if you have a painful deformity that requires surgery, then your insurance should cover it.
Okay, great. Another common question that we've gotten a lot this evening is, can I get the Lapiplasty procedure done for both my feet at the same time?
Lapiplasty and what?
If a patient has bunions on both his or her feet, can they get the Lapiplasty procedure done on both their feet at the same time?
No, not by me. I advise against that. You need a good foot to walk on while your one foot's recovering. Typically, I would imagine like 10 to 12 weeks in between surgeries.
If someone is interested in Paganelli, how would they be able to locate you and find you to set up a consultation?
So I am in Chambersburg, Pennsylvania, and we have a satellite office in Waynesboro. I know it was introduced in Waynesboro, but we're actually in Chambersburg, Pennsylvania, which is South Central Pennsylvania. I am on the website. If you go to www.lapiplasty.com, you can type in, you can search for a doctor or a provider, and you can type in your zip code, and it should bring you to the doctors that are near you.
All right, we have time for a few more questions, so I'm going to go through a couple more that have come in a little bit later. Dr. Paganelli, how flexible is the toe going to be after the Lapiplasty procedure?
So
will it allow any?
Go ahead. Sorry. I didn't know if there was more to that question.
No, you're good. It is, how flexible is the toe going to be after the Lapiplasty procedure?
So it should be as flexible as it was before, or even more flexible. the toe joint, not the joint in the middle of the foot where we fused. That's not going to move anymore, although you don't notice that it moves now. But your big toe joint should move in its natural, normal alignment. Now, every once in a while, you get a patient who gets scar tissue or it gets scarred down. We typically send those people to physical therapy, and they can work that out pretty quick. But I start range of motion exercises of that big toe joint, usually within the first 2 weeks, so that doesn't happen.
Another question that has come in. If you are pregnant, get the procedure done.
No, I would never do an elective procedure on a pregnant person. It's not a good idea, and I don't know anybody that would. It's too risky for something that can wait, as it's elective. So elective surgery can wait.
Okay. Another duplicate question. Can my hammer toe be corrected at the same time that I get the Lapiplasty procedure done?
Yes, we do that all the time. It doesn't lengthen your recovery. It is definitely recommended to have the procedure done at the same time as a Lapiplasty, and we typically do that.
Okay, great. Dr. Paganelli, in your experience, how long after the surgery does it take for your patient's foot to feel normal again?
So usually, and this is my personal experience, and also what we hear when we study and we take our boards, these are all kind of normal questions like this. So when you have surgery, no matter what, it's going to take a long time to feel 100% again. Now, I have patients that say they feel great, their foot feels better than ever within 8 to 10 weeks after surgery. But I would imagine to feel 100% like, oh, I didn't have anything done, 6 months. And that's just because with gravity, you're going to swell, like minor swelling, for at least 6 months. Not a lot, just on and off. Like if you're on your foot all day for 10 hours, 4 months after surgery, you're likely going to have a little bit of swelling. And it'll take about 6 months for that to go away.
How do I know if I'm a good candidate for the Lapiplasty procedure?
Well, you'd have to, see a surgeon, see a certified Lapiplasty surgeon, get x-rays, and we'd have to look over your medical history and your current medications, and also know that you have pain. If you have pain 3 to 5 days a week, in my book, you're a candidate. If you don't have any pain, it shouldn't be done, because there's too much risk with any type of surgery to have surgery when you don't have pain, because you can always have a complication. These complications aren't common. They're very uncommon, but it can happen.
Is there any way to correct a bunion without having surgery done?
No. It's a bony deformity with a biomechanical imbalance, and it is progressive. You can pad it, you can cushion it, you can slow the progression with orthotics, you can wear wide toe box shoes so the nerve doesn't rub, but it will continue to grow. I have lots of patients that have really bad bunions and have no pain. And then I have some patients that have a very, very mild bunion but are in excruciating pain. But I have not found or seen anything that is conservative care that will stop or reverse a bunion. It really doesn't exist because of the bony deformity.
Okay, we have time for one final question, and I'm going to do one that I've seen pop more time. If I've had a previous bunion surgery, could this be done to correct that?
Yes, we do that quite often. This procedure is typically permanent, which is why I do it. And if you had any of the other procedures we talked about, either the 2D or head procedures, or you had a previous Lapidus procedure that failed and your bunion has returned, this is absolutely something that can be done to correct it.
All right. Thank you, Dr. Pelli. So as we begin to wrap up now, if your question did not get answered or you think of something later that you wish you'd ask, feel free to reach out to us. Our email address is patientinfo@treece.net. You can also learn more or find a local doctor by visiting our patient website, lapiplasty.com. Don't forget that as a follow-up, we will email all registrants an archived webinar link for reference. We hope you found the information presented tonight helpful. Dr. Paganelli and I appreciate you joining us this evening. Have a great rest of your night.
Thank you, everyone.